So hi everyone, just got a minute or so to wait before we kick off, but welcome everyone to today's Bite-Sized Science webinar with Dr. Monique Francois. I don't know if anyone has dialed in this week. We've had a webinar each lunchtime at 12:30, and tomorrow is no different. Tune in tomorrow to hear Dr. Yilian Chu at 12:30. And she'll be talking about what we can learn from the humble worm. She's a great presenter, so that will be a lot of fun. Could I ask, can everybody hear me okay? No one's having any technical issues? Liz has asked, will the slides be made available afterwards? The whole presentation, Liz, will be available afterwards. I can check with Monique whether she's happy to share the slides, but certainly the videos, once this is all being recorded today, and the videos will be made available to every single registrant hopefully next week, so you can re-watch them. And if you haven't been able to watch the other webinars that we've had this week, you can also dial into those. Okay, so we've just ticked over to 12:30, so I think we'll get started. Are you there, Monique?
Yeah.
There she is. Okay, so welcome again, everybody, to our fourth Bite-Sized Science webinar of this week with Dr. Monique Francois. So for those of you who don't know me, my name's Kate. I'm the Community Engagement Coordinator for IMRI. And IMRI, of course, Illawarra Health and Medical Research Institute. For those of you who don't know, IMRI is a not-for-profit charity, and our goal is to support health and medical researchers like Monique, so researchers in the Illawarra Shoalhaven region of New South Wales, and our goal is to bring our researchers and health professionals and doctors together to help solve our biggest health challenges. So we do research at IMRI into cancer, diabetes, mental health, and dementia, to name just a few. If you go onto our website, you can see a whole list of all the different research areas that we cover. And our region is really special in that it's incredibly diverse. For various reasons, it provides a really great snapshot of the whole of Australia. So it's a really good spot to have our research taking place. And before we get started, I just want to say a really big thank you to all of the staff and researchers and students at IMRI. It's been a really challenging time these past few months, and we know that everyone has put in a huge amount of work to ensure that research can continue, and researchers have done a lot of work to make sure that they can put their teaching online for our students. So a massive thank you to everyone for being so adaptable. And also thank you to our community groups and individuals who support us and allow IMRI to continue the work we do. So on to our webinar. Can everyone just confirm in the chat, or some of you could just confirm in the chat that you can hear and see us okay? Oh. Yep, fantastic. If you have any questions throughout the webinar, please pop those questions into the Q&A box, and that way I can manage those questions and present them to Monique after her presentation. So, Dr. Monique Francois. Monique is passionate about exercise, nutrition and health. She teaches exercise physiology, and her research interests are on optimizing exercise for therapeutic health, with particular focus on diabetes and cardiovascular disease. So I will hand you over to Monique.
Thanks, Kate. I'll just bring up my presentation. How's it look? All right, so as Kate mentioned, my focus is on reducing the impact of chronic disease using both diet and exercise, and ideally the combination of the two. So what do? I develop and test diet and exercise interventions with the emphasis on simple but effective interventions that people can follow in addition to standard care. So in terms to a large focus of our research at the moment is looking at how we can control peaks in blood glucose. So this here is a glucose trace from someone who is insulin resistant. So this means that the hormone insulin that is usually released after a meal to help control glucose or help remove glucose from the blood. So if that hormone isn't working as well, you can see these peaks and troughs in glucose. So here we can see a continuous glucose trace with a rise after breakfast, lunch and dinner as an example. We know that these peaks and troughs or fluctuations in glucose, they are particularly damaging for our organs and especially our arteries. And so this can contribute to cardiovascular disease. So in terms of my research, I'm looking at ways with exercise that can reduce these peaks in glucose. So we know that exercise can work in combination with the hormone insulin or instead of the hormone insulin. So muscle contractions can help remove glucose from the blood, even if insulin isn't working very well. So these muscle contractions simply take the glucose from the blood and then they can store it as glycogen in our muscle. So then it's not going to go and damage those arteries or nerves, for example. So exercise is one strategy. And another strategy that we're looking at is using diet. So specifically, we're looking at reducing carbohydrates because some of these carbohydrates particularly can cause these rises in glucose levels. So simply not by restricting carbohydrates like all throughout the day, we're looking at just having smaller amounts at each meal to help spread it across the day so we're not getting such large peaks in glucose. So these are just two examples that we're testing in our research to find out which one can reduce the peaks in glucose and then also how this can impact the health of your blood vessels. So ideally, if we can spread that across the day, we can see less fluctuations in glucose levels. So this may in turn prevent cardiovascular disease in people that have insulin resistance or type 2 diabetes. So a recent grant that I was awarded is simply testing the strategy in a randomized control trial. So by a randomized control trial, we will randomize individuals to 4 different groups. Timing small amounts of exercise after meals to prevent these peaks, or restricting the amount of carbohydrate at each meal, or a combination of the both, and then compared to a control group. So we already know that these strategies can lower these fluctuations in glucose. What we don't know is then, can it improve the health of your blood vessels? So at the moment, this is a hypothesis that if we can reduce this glycemic variability with these strategies, that in turn may prevent cardiovascular disease. But that's what we're planning on testing across the next 3 years. In terms of my research, I work across type 2 diabetes, gestational diabetes. So this is diabetes in pregnancy where your hormones or other risk factors can predispose you to having high glucose in pregnancy. But this typically disappears after the birth of the baby. However, gestational diabetes does have complications that are associated if you have poorly controlled glucose levels, including a large baby, delivery complications, and also women that have gestational diabetes are twofold at greater risk of developing diabetes later on in life. So my research focuses across these levels of insulin resistance, for example. The techniques that we use in my lab, so these are just 2 of the examples. We've got continuous glucose monitoring. So this allows us to measure glucose levels every 5 minutes across 7 days to 2 weeks. So we can really measure these peaks and troughs in glucose and then look at the influence that our interventions have on these glucose traces. And then in the right-hand picture, we have a picture of vascular function. So where we use ultrasound, so this is non-invasive, where we can look at the artery. So you can see in this picture here, we have a nice clear artery with good blood flow. And then we can test how well it vasodilates, and then also the level of atherosclerosis or plaque that's forming. So I mostly run human clinical trials, and I supervise and mentor and I guess employ research staff and students to do all the work with me. So it's definitely not a one-person game. And so most of my day, I guess, is spent in meetings and working with different people to help achieve these goals, teaching the students different techniques, working with the data and reading research papers, and of course, writing grants. But what I really do is manage a team of very intelligent and hardworking people. And so these are the lovely ladies from last year who do a lot of the research in my lab and help me to better understand how we can prevent cardiovascular disease and the complications that arise with diabetes. So in terms of, this isn't how I got into research, which is the question, but this has definitely informed the future research that I want to get into. So 2019, I was pregnant with Olivia, and I was actually diagnosed with gestational diabetes myself. So this was the elevated glucose levels in pregnancy, despite not having any of the risk factors that are usually associated with gestational diabetes. So for example, when you're towards the end of your second term of pregnancy, you complete this glucose challenge where you drink this glucose drink and then your glucose is measured for 1 and 2 hours afterwards. And so my 1 hour glucose was over the 10 millimole threshold at 10.9. In terms of the treatment, based on what I knew from my research so far, I was able to manage my blood sugar levels by restricting the amount of carbohydrates that I had in one sitting to less than 1 exchange. I also did 10 minutes of post-meal walking because, as you know, when you're pregnant, you definitely crave certain things. So I knew that if I did have that chocolate croissant from the university cafe, I could just go and walk after the meal. So then this would help remove the glucose from the blood. And then by controlling those glucose levels, I was fortunate enough to deliver a normal sized girl at term. So this just kind of shows that if you are able to control your glucose levels, and I was lucky enough to be able to do so, you can prevent some of those complications that are right across the literature in terms of the negative effects of gestational diabetes. What was more interesting, I guess, was that after birth, you're told that you don't necessarily need to check your glucose levels because once the pregnancy hormones are gone and you deliver your baby, your glucose levels essentially return to normal. But doing the glucose test again, so 12 weeks postpartum, and this is part of standard care, my 1 hour glucose was actually worse than it was during pregnancy. And then the 2 hour glucose was diagnosed with type 2 diabetes or some form of diabetes, where my 2 hour glucose was 11.9 and the diabetes diagnosis is greater than 11.1. So using the knowledge from my own research, I guess I switched back to the restricting carbohydrates that I have at one meal, and my students will all say that I'm very good. I continued my normal exercise because I'm already super active anyway, and I know the benefits of that. And my HbA1c, so this is the measure of glucose, so not the continuous glucose monitoring per se, but this is like a 3-month average of the glucose that your hemoglobin levels were exposed to. And so this is what they test to see how your diabetes is every 3 to 6 months. And so my levels were normal in both November and July this year, and maybe perhaps even better than a lot of the population at 5.0%. So I guess that's not how I got into this research, but it's definitely motivated me to continue with this research so then we can improve the care of people with gestational diabetes, type 2 diabetes, and ultimately prevent those complications such as cardiovascular disease, in which about 80% of people with diabetes actually end up dying from. And if you're interested in participating in any studies or want to hear more about studies, we've just received approval to continue face-to-face research. So my students and I are super excited about that. And we have 3 current projects which are related to my talk that we can discuss if anybody's interested. Thank you very much for listening today.
Great, thank you so much, Monique. You could just unshare your screen. That's wonderful, thank you. So does anybody have any questions for Monique? You pop those in the Q&A box. While I'm waiting for those to come through, I might just ask a question. Monique, you mentioned that despite not having any of the risk factors, obesity, for example, you develop gestational diabetes. Do you know why some women do develop gestational diabetes and why some women don't?
No.
That's what the research is for?
No, no one really. It's a very complicated thing, and the research doesn't really know a lot about it, and that having poor glucose control after pregnancy, that kind of suggests that I might have had poor glucose control even before pregnancy. I just didn't know about it.
Yeah. So there aren't any symptoms that your body might let you know that you have poor glucose control?
Well, you don't. Well, the way that they test it is 75 grams of glucose, and I would never consume that in one sitting anyway. So, well, even when I was doing the test, like I didn't feel any different. So I did it. There are definitely symptoms. So say frequent urination, thirsty. That's the common symptoms of diabetes. Yeah. But I didn't have any of those, no.
Okay. So I have a question from Karen. Karen would like to know or like you to describe perhaps what you would consider to be a low carbohydrate breakfast.
Yeah, so this study is under 10% of carbohydrates. So of the total calories that you're consuming for breakfast, this study is under 10%. And so this is based on an acute study where we tested a carbohydrate breakfast that was less than 10% versus a normal carbohydrate breakfast of 40%. And we saw that it eliminated that post-breakfast peak. And we know that usually the peak after breakfast is the largest. So the hypothesis for the study is that if we can eliminate perhaps that largest peak across the day, we might improve overall glucose control. But what I'm really interested in, obviously, is the impact of this on vascular function and blood lipids, because we're swapping out the carbohydrate for the fat. So we really need to test the impact on those other risk factors as not just glucose.
Yeah. Sue Martin has messaged and said, you say that you reduce your carbohydrates to reduce your glucose responses. Do you also look at the glycemic index?
Yes, definitely. And so any carbohydrates that I choose to eat, I always look for the lower glycemic index carbs, or those that have perhaps more fiber. Yeah. But in terms of the research that we're doing, that's going to be a huge focus as well. So it's not only the amount that they're having, but I think we're still developing that protocol to try to make it as user-friendly as we can. And I'll be asking for lots of input when we can help to develop that.
Yeah. So you said that you like to stay quite active. What sorts of sports or activities do you choose to participate in?
Well, it's different now that I've had a little baby. So I guess now, when I'm at work, my favourite thing to do is to hike up the Robson Road Mount Kera track as fast as I can. And go for a cycle. Like I've got a little bike seat that Olivia can go on. Lovely. But yeah, anything that gets my heart right up.
Yeah, okay. We've got a question here from Liz. She wants to know, she appreciates that you're recruiting for a trial, but what's the best way for people to keep across your progress? Do you, is there somewhere they can go to see what type of research you're doing? Is it keeping on top of the IMRI webpage? How can people see what you're up to?
That's a great question, because I would really like to be able to do more social media stuff and update stuff. and I really should do that. I just can't. I just don't have the time. So I guess the best way would be, I need to get better at that, definitely.
We can help you with that, Monique. Okay, so we've got some other questions here. What do you enjoy most about being a researcher?
Working with my students.
With your students? And
Definitely.
How many students do you have at the moment?
Not only my students, but working with other people who are passionate and, you know, are working towards the same goal, and they always drive me in what I'm doing to, you know, do it better, learn more, and everything like that.
Yeah.
So it's so good being to be able to be back on campus, for sure.
That's great. And how many students do you have that you're working with at the moment?
So I have 4 PhD students, 2 honours students, and then I have 2 PhD students that are just on hold at the moment, waiting for the whole situation to.
And you mentioned your personal experience has helped you to stay focused on this particular area, but what got you into the career path of research in the first instance?
So I went to university and did an exercise science degree because I wanted to be a biomechanist for a sports team.
Right.
And then my biomechanics teacher was very boring, and so I switched to physiology. And the professor there, he just really inspired me to get into research and find out more, and just I did honours, and then it just
that's fantastic.
Never stopped.
And now your personal experience is now a clearer motivation to which direction you go in with your research.
I guess I already started in this direction prior to that. So it was a bit of it was very, I don't know what the word is, but it definitely has inspired me to find out more, especially when thinking about, you know, perhaps future pregnancies and things like that.
So is there anything that you can do to reduce your chances of getting gestational diabetes with a next pregnancy?
Nothing that I can do, because I don't have any weight to lose. I don't think I could be more active and eat any differently. So I know, and so, you know, some people have gestational diabetes in one pregnancy and then not in the next. You know, so those hormones we have no control of, I think. But I'll leave that to some of the other, you know, there's a lot of professionals that are trying to work in this space to perhaps figure it out, because especially with the new diagnosis criteria, there is up to about 20% of women are actually being diagnosed with gestational diabetes now. So it's the fastest growing subtype of diabetes. So.
Okay. Can I ask you, Monique, so when you're moving in your chair, I think it's scraping against your microphone. There's a bit of a scratchy noise on this end, just to let you know. So you said that the cases of gestational diabetes are increasing, and again, do we know why?
It's a combination of women perhaps having pregnancies later at an older age, obesity, but also the diagnostic criteria has become a lot stricter.
Right. Okay. So more people are falling under at that threshold.
Yeah, because they showed that even at those lower glucose levels, there still can be complications for the baby.
Okay. And Karen would like to know, do you have any stats? Are you able to answer this on how many mothers actually attend their 3-month glucose test after the birth of their baby?
Yeah, so one of my students is going to look at this, especially because this year and Bob Moses is actually really interested in this, the diagnosis of diabetes is whole changed. So women are not getting the glucose tolerance test unless they have risk factors.
Right.
And so it's just being based on fasting glucose. And so my fasting glucose was perfectly normal. So I would have gone throughout, if I was pregnant this year instead of last year, I wouldn't have been diagnosed with gestational diabetes. But the number of women that I don't know the percent, but I've been told it is extremely low.
And so had you not been diagnosed, what would the implications then have been?
well, I can't say, but based on the research would have said that, you know, I might have had complications in delivery. Olivia might have been, you know, too big, you know, cesarean, things like that. But I really can't say.
If you weren't a researcher, Monique, what profession do you think you would have followed?
I don't know, because I was deciding if I was going to be a vet or
A vet, okay.
or an exercise science, just because I loved animals at the time.
Yeah.
Or an athlete. I think if my mum hadn't have pushed me towards being more academic, I probably would have gone representative sports way.
Yeah, wow. In which particular sport?
Soccer.
Okay. Fantastic. Did you still get to, well, I imagine not now that since Olivia's been born, but did you play soccer previously?
Yeah.
Fantastic. And so you said, just to get back to your research, that you're obviously currently following a study and you're recruiting participants for that. When do you expect to have results? When do you expect to have findings for your research?
So the vascular stuff, we can get those measures quite quickly, so probably in around 2 to 3 years. But in terms of the hard outcomes of cardiovascular disease, we're following this particular study up for 5-10 years, 15 years maybe even.
Oh, right. Okay.
So we will have indications of whether it improves your blood vessel health, but we won't know whether there are any changes in actual diagnosis of cardiovascular disease for a long time.
Okay. Does anybody have any last questions for Monique? I might just ask you one more question, and that's around COVID. I mean, obviously that's the reason that we're meeting over webinar and not face-to-face today. Has COVID-19 impacted your research at all?
So all face-to-face research was halted between March to now, I guess. And we lost a lot of data on participants when it was abruptly halted in March, so significantly impacted.
Yeah, so lost as in you couldn't continue the testing?
Yeah, we weren't able to follow them up or take any post-intervention measures or anything.
So once restrictions are reduced, you'll have to start again with that research?
Yeah.
Okay. And is that's the trial that you're currently recruiting for?
All 3 of those actually.
Yeah. Okay.
And some of them have been designed to be remote style, so we're not doing the measures that we usually would either.
Okay. So if people do want to get involved with that, they can just send you an email perhaps?
Yeah.
What's your email address, Monique?
Francois@uow.
@uow.edu.au. I've just popped that email in the webinar chat. So if anybody is interested in getting involved in Monique's research, please send her an email. I'm sure she'll be delighted to hear from you. So I think we're just about out of time. So Monique, thank you so much for taking some time out. I know you're incredibly busy at the moment, so thank you for taking the time to put the presentation together and to talk to us today.
Thank you very much.
Thank you, and thanks everyone for dialing in. Before you head off, I'll just share my screen with you to let you know that we have one more webinar this week as part of National Science Week. That's with Dr. Yilian Zhu, and she'll be talking to us about what we can learn from the worm. She's a great presenter, so I really encourage you to sign up to that. If you haven't done so already, you can do so the same way as you registered for today through eventbrite.com.au. And keep an eye on our social media pages. As part of National Science Week, we have a different lab group from IMRI taking over our social media. So there's lots of exciting activities and posts on our social media. So you can find us at facebook.com/IMRI and on Twitter @IMRI. And of course, we are being a not-for-profit. We would be really grateful if you're able to make a donation to IMRI to allow us to continue our research. You can do that on our webpage, imri.org.au. And if you're interested in the other types of research that we do, all of that information is on our webpage, so you can have a look and see the type of research that we do. There'll be a survey that will pop up at the end of this webinar, so if you do have 2 minutes, please do fill that survey in. I feel like webinars aren't going anywhere, so we really want to make sure that we're providing the content that you're interested in.